Tonight, our team coverage kicks off with hospital concerns varying from supply to staffing. We'll begin with Alexis Zotos at Barnes Jewish Hospital in the Central West End. Alexis?
Steve, right now there are new safety procedures in place at Barnes Jewish Hospital and all the hospitals in the BJC healthcare system. They will be checking the temperature and the system of staff as they are coming into work. That is one of the things that they are doing to protect everyone here at the hospitals. We're also checking in with them on how they're doing in terms of masks and beds for when we could see a surge in patients.
If we can't take care of you, you can't take care of our patients.
That's the message from Denise Murphy, BJC's chief nurse, to the system's nurses and staff. BJC is one of the largest hospital groups in the region. Right now, Murphy says the staff has the personal protective equipment they need, but they're seeking more donations every day and are allowing some staff to wear cloth masks.
Right now, for people doing patient care, we are not allowing cloth masks because we are not sure that that can keep them safe. The effectiveness is not proven, so we want to still provide the medical grade masks, and we do have the supply to do that.
Missouri Governor Mike Parson says 106,000 N95 masks and 17,000 surgical masks are on the way. But is that enough? We asked the man in charge of supplying BJC's 15 hospitals.
Not surprisingly, we've seen demand has increased tremendously. For example, in a historical flu season, we'd use just under 100,000 isolation masks a week. And what we're seeing is we're projecting over the next couple of weeks, next several weeks, to use above 500,000 isolation masks per week.
He's concerned about what lies ahead. The same concern Dr. Stephen Lawrence has when it comes to the number of hospital beds if we don't abide by the stay-at-home orders.
All that we're doing right now, we'll see the impact in 2 weeks. And that is about the time where we're really starting to expect to see the highest level of activity.
On a regular basis, hospitals like BJC operate close to capacity. Now, they are seeing fewer patients for things like car accidents because, well, the roads are pretty empty, but it might not be enough.
That is the biggest concern that we have, and that's the entire basis for this concept of flattening the curves.
So, that concern over the number of beds is exactly why the governor has asked the National Guard to scope out alternative care sites across the state for the potential of adding more beds. Right here in the St. Louis area, they are looking at the dome at the America Center if it comes to that. Reporting live in the Central West End, Alexis Zotos, News 4.